News now from Germany, where another 1,244 COVID-related deaths have been reported in a 24-hour period, which is the highest daily figure since the start of the pandemic. Chancellor Angela Merkel wanted a mega lockdown, according to reports, shutting down the country almost completely for fear of the fast-spreading variant of the virus, which has been first detected in Britain. Well, to talk more about the situation in Germany, we're joined by DW reporter Emmanuel Chase. Thank you so much for joining us. Tell us, is the current lockdown likely to be reconducted?
Yes, the figures are still not good here in Germany, and Chancellor Angela Merkel warned that the country will go through 8 to 10 very tough weeks. Now, the daily death toll is around 1,000, and daily number of infections is way too high as well. Nationwide, the 7 days incidence rate is 3 times higher than what is already considered a critical threshold of 50 cases per 100,000 inhabitants. Additional measures were introduced this week in districts where the incidence rate was superior to 200 cases per 100,000 inhabitants, mainly movement restrictions within a 15 kilometers radius in worst affected districts. Only necessary travel is allowed, and there's also a curfew in some districts. That was already the case back in December, and some minister presidents of region are now admitting that they should have listened more carefully to what Angela Merkel and scientists had said when they warned that tougher measures were necessary to curb the infections. That's the case, for example, of Minister President of Thuringia, Bodo Ramelow, who said remarkably that he admitted being wrong in his choices to tackle the pandemic.
All right, well, it's good that leaders admit that they've been wrong. And what would tougher measures really look like?
Well, this is something that has been debated here, which tougher measures to implement. For example, this would be working from home. This has only been recommended so far and not in any way made compulsory. So it's pretty much at the discretion of each company to implement. The schools are already closed until the end of the month, but that could very well be reconducted. And the 15 kilometers radius when it comes to travel could also be generalized. For example, businesses are already closed, so it's very likely that they would remain so.
And here in India, we're about to begin the vaccination program. Tell us about the vaccine program in Germany so far.
Well, the government drew critics for its rollout of the vaccine. It looked very promising at first, with more than 400 vaccination centers set up all over the country. Here in Berlin, there's even 2 former airports that are being used as vaccination centers, and another center has a vaccination capacity of up to 5,000 vaccinations a day. Yet nationwide, daily vaccinations do plateau at around 50,000, and that's far from the initial objectives. And Health Minister Jens Spahn had warned that January and the first weeks of vaccinations would be challenging before picking up, but this is taking too much time for some. And the government is trying to ramp up vaccination production, with a new production site for the BioNTech vaccine in Germany being set up. It should be operational by March, and the Moderna vaccine will start to be distributed next week. Now, among the population, 1/5 of Germans are skeptical about the vaccine and would refuse it, but over 60% of the population is willing to get vaccinated.